we will immediately bring this to you. If you are not interested, we will explain the whole science and make you interested in enlightenment time. We need to cater where they are, because enlightenment is the birthright of all human beings. Kailasa is responsible to provide that to all human beings. Kailasa is the totality of the knowledge I received from my gurus and practice manifested in my life, perfected by teaching millions of people from all.
Nithyanandam, everyone. So welcome back. In this segment, we are going to learn about the multi-layer quarantine COVID care protection centers at the Kailasa's de facto spiritual embassies. With the blessings of the Supreme Pontiff of Hinduism, Jagat Guru Mahasannidhanam, His Divine Holiness Bhagwan Nithyananda Paramashivam blessings, let's start with the Sadguru Vandanam. Nithyanandam Paramasugadam Kevalam Jnanamurtim Dvandvatitam Gagana Sadrusham Tattvamasya Ekam Nityam Vimalamachalam Sarvadi Sakshibhutam Bhavatitam Triguna Rahitam Sadgurum Tam Namami. So what we learn from this segment today concerning statistics on mental health and global peace across world due to COVID-19 pandemic. What are the Supreme Pontiff of Hinduism and Kailasa's contributions? Why temple-based ecosystems and Kailasa's COVID care protection centers? Some glimpses, and UN recognizes Kailasa's contributions and join Kailasa's COVID care protection centers. Coming to concerning statistics related to the COVID care, COVID-19 situation, the World Health Organization makes a big statement about Delta variant of COVID-19. The World Health Organization on Tuesday said that the Delta variant of coronavirus has elbowed out all the three other COVID-19 variants of concern that now represent a tiny fraction of the samples which are being sequenced. Less than 1% of alpha, beta, and gamma are currently circulating. It's really predominantly Delta around the world, said who's technical lead on COVID-19, Maria Van Kerkhove. The Delta variant, which was first detected in India last year, has become more fit and it is more transmittable and it is out-competing. It is replacing the other viruses that are circulating. She said and added that the variant has been detected in more than 185 countries till date. COVID-19 has now killed more Americans than the influenza pandemic of 1918 and 1919. The coronavirus pandemic has now killed more Americans than the 1918-19 influenza pandemic did. The 1918 to 19 affected about 25% of Americans and killed an estimated 65% with 675,000 deaths. COVID-19 has infected more than 12% of Americans and killed about 0.2% with 676,000 deaths. From COVID-19 has surpassed 676,000. The coronavirus pandemic has killed more Americans than the 1918 influenza pandemic did. Axios and the Associated Press both reported the grim milestones on Monday. COVID-19 is now officially US deadliest pandemic as death toll crosses that of 1918 and 1919 flu. COVID-19 is now officially US deadliest pandemic, surpassing the estimated US fatalities from 1918 influenza pandemic. People infected with alpha variant enhances 100 times more virus into the air than original COVID strain, according to a study. The University of Maryland researchers suggested that the need for better ventilation and tight fitting masks in addition to widespread vaccination to help stop spread of the virus. The findings showed that the amount of virus in the air coming from alpha variant infections was much more, 18 times more than could be explained by the increased amounts of virus in nasal swabs and saliva. These major increases in airborne virus from alpha infections occurred before the Delta variant arrived and indicate that the virus is evolving to be better at traveling through the air. We know that the Delta variant circulating now is even more contagious than the Alpha variant. Our research indicates that the variants just keep getting better at traveling through the air. So we must provide a better ventilation and wear tight fitting masks in addition to vaccination to help stop a spread of the virus, said Dr. Don Milton, professor of environmental health at the University of School of Public Health. All these days we were thinking the 6 feet distance can prevent us from contracting the COVID. But now we have come to a situation because of the airborne or other situations that 6 feet distance may not be enough to prevent viral transmission indoors. According to a study in Washington, the physical distancing of 2 meters, about 6 feet, 6.5 feet, may not be enough to sufficiently prevent transmission of virus carrying airborne aerosols indoors, according to a study. The result published in the journal Sustainable Cities and Society suggests that the physical distance alone is not enough to prevent human exposure to exhaled aerosols and should be implemented with other control strategies such as masking and adequate ventilation. The researchers examined 3 factors: the amount and rate of air ventilated through a space, the indoor airflow pattern associated with the different ventilation strategies, and the aerosol emission mode of breathing versus talking. They also compared transport of tracer gas typically employed to test leaks in the airtight systems and human respiratory aerosols ranging in size from 1 to 10 micrometers. Aerosols in this range can carry SARS-CoV-2, the virus that causes the COVID-19. COVID-19 Delta variant still most concerning, says the World Health Organization experts. Even with the emergence of the new COVID-19 variant, the Delta strain remains the top concern globally, appearing to outcompete others, senior officials with the World Health Organization said recently. I think the Delta variant for me is one that's most concerning because of the increased transmittability, said Dr. Maria Vanker-Kove, the agency's technical lead for COVID-19, speaking during an online question and answer session. It is doubly transmittable compared to the ancestral strain, which means that it can spread more people. In US, the COVID-19 pandemic is nowhere under control, and says the chief medical advisor, Anthony Fauci. He said, right now, we are still in pandemic mode because we have 160,000 new infections a day. That's not even modestly in good control. In an interview with Axios, the US has reported 40 million cases of COVID-19 since the outbreak of the virus, with over 4 million infections adding up in the past few weeks. The increase in COVID cases comes as the US administration earlier this month announced that it is planning to provide booster shots of the vaccine as the Delta variant has become dominant in the nation and is wreaking havoc. This surge in Delta variant is driven by the low vaccination coverage in many communities around the US. according to the US Centers for Disease Control and Prevention. In a country of our size, you can't be hanging around and having 100,000 infections a day. You have got to get well below 10,000 before you start feeling comfortable. COVID-19 violent incidences and fatalities. On one side, the virus is airborne and it is more transmittable than before. And because of the not only health concern, now it is making a world less peaceful. And it is affecting the mental health, which is the younger generation are affecting the mental health issues like anxiety and a depressive disorder due to the pandemic. And the average share of the adults reporting symptoms of anxiety and or depressive disorder, January to June, which was a 6 months period, what it was 11%, now it is rose up to 41%. Stress in America 2020, a national mental health crisis. COVID-19 is a significant stressor for most Americans. Nearly 8 in 10, 70-80% say the coronavirus pandemic is a significant source of stress in their life. Nearly 7 in 10, which is 67%, say they have experienced increased stress over the course of pandemic. More than 60,000 US healthcare workers have contracted COVID-19 and 300 have died. Of the health workers who treated patients during China's COVID-19 outbreak, 50% showed signs of depression and 45% showed signs of anxiety. And the self-reported mental health among pregnant women and new mothers before COVID-19 pandemic, depression, what it was 15%, now during the pandemic, it is increased to 40.7%. And the anxiety before was 29%, now it rose up to 72%. Living under stay-at-home orders, 8 in 10 students are struggling with focus on school or work and avoiding distractions. Students are interacting most with parents. During the COVID-19 physical distancing, parents support students simply by spending time with them, ranked much higher than talking about COVID-19 news. Number one challenge, the college students' mental wellness, a virtual face-to-face time for high school students, digital social gatherings. 55% of all the students do not know where to go for help for their mental health. Understanding the pandemic's impact on working women, nearly 82% of women surveyed said their lives have been negatively disturbed by the pandemic. Nearly 70% of women who have experienced these disruptions or can concern their career growth may be limited as a result. The global economic outlook during the COVID-19 pandemic, a changed world. The pandemic is expected to plunge most countries into recession in 2020, with per capita income contracting in the region of countries globally since 1870. The COVID-19 recession has seen the fastest, steepest downgrades in consensus growth projections among all global recessions since 1990. Most countries are expected to face recessions in 2020. International Labour Organization. COVID-19 is a threat to peace building in conflict-attracted nations. The COVID-19 crisis has worsened already fragile situations. The ILO is more aware than ever of its responsibility to promote peace and resilience in the time of this global pandemic. The city's mayor has said that, the Mumbai city mayor has said that the third wave of COVID is already upon Mumbai, pointing to a sudden spike in cases. The third wave of COVID-19 is not coming, it's here, said the Kishori Padman to remain in their home. They 10 people and have them work in shifts.